Thank you very much for giving me the opportunity to be here today. Regarding laser treatment in prostate diseases, I think as most of people will know, but generally speaking, men after the age of 50 start getting some symptoms in relation to their waterworks, like urinary frequency, urgency, and not being able to empty their bladders very well. And it tends to increase, these symptoms tend to increase with progressing age in men, and this is caused by a prostate which slowly enlarges as the age progresses. And these are the symptoms we're talking about, which affect about 70% of the men by the time they reach the age of 80. So from 50 to 80, there is a range, but in the eventually majority of men will experience some of these symptoms during their lifetimes. And these are generally caused by a prostate which is enlarging. And laser comes into play because that gives the minimally invasive technique, which is the safest available today when surgical removal of the prostate is needed. So that is what it entails. Laser energy, what it does is it produces high temperature at the site where it is used. And when we use this in prostate, there are two kinds of lasers. One is called green light laser, and the other is called holmium laser. I think probably not the right forum to go into too much detail, but they work differently. The green light laser evaporates the prostate, while the holmium laser allows you to use laser as a knife that cuts very precisely without causing any bleeding. So what we are aiming to do is to remove the tissue which is causing the obstruction. So there's high temperatures which are produced at the site of surgery, and that in turn leads to allowing us to remove the tissue in a non sort of traumatic manner. However, having said that, there can be complications and side effects because of these thermal effects transmitted beyond the area which one wants to operate on. And these can then cause some discomfort and pain in the postoperative period. Occasionally, if urethra, which is the pipe leading to the prostate, gets damaged in the procedure, that can cause a narrowing or a stricture. So these are the kind of things which can happen, and then infections are always a risk in the postoperative period. So we do cover everyone with antibiotics to avoid this. So these are some of the common ones. Yes, in prostatic patients with prostatic enlargement, we use these surgical techniques when the medical therapy has failed. So these patients will be treated by certain kinds of drugs or medicines, which can deal with more than 50% of these patients without the need of any surgical intervention. However, the other group which does require surgical intervention, the laser therapy or the laser treatment is the best one available, and we tend to use it in that group of patients. Now, what it does, as I previously said, we are aiming to remove the obstructing part of the prostate using it. And in terms of actual procedure, it is done under an anesthetic, and we use a special piece of kit which allows us to see directly the prostate through the urethra. And the laser is a small fiber that is passed through the that instrument, and when the surgeon is operating, he is directly seeing what he is doing. Conceptually, this treatment is to relieve obstruction. And if I give you a simple example, prostate, it can be considered like a orange. So these surgical treatments for benign prostatic disease, which includes laser as one of the important modality, what we do is we remove the pulp of the orange and leave the peel behind. And as it happens, the cancer in cases of prostate happens more commonly in the peripheral part or in the shell of the orange. So although lasers or laser techniques can be used in prostate cancer patients who have obstruction or where the prostate is causing obstruction to the urine flow, but it is not treatment of the cancer itself. So it will not cure the cancer, but it can help the patient where required.